namesake of the Emily Curritt Cancer Center at the University of Virginia passed away from pancreatic cancer in 2001. This type of cancer needs to be caught early, and today we're joined by Dr. Todd Bauer for our house call. And let's start with exactly what the pancreas does and why it's so important.
Sure. The pancreas is a small gland located deep behind the stomach. It has two main functions. It makes enzymes that aid in digestion, and it produces insulin to help control blood sugars.
And are there certain risk factors you want to look out for that can make one more prone to this type of cancer?
Certainly. Obesity and smoking and diabetes are three common risk factors. In addition, about 10% of patients have a genetic predisposition. So if you have two or more first-degree relatives with pancreas cancer, you're at increased risk. Or patients with some types of cysts of the pancreas have an increased risk.
And are there early warning signs so you don't get caught off guard?
That's the tough part with this disease. Most patients don't develop any symptoms until late in the course of the disease. Those might include jaundice and weight loss, but typically it's kind of late in the presentation.
And are those things that you get and you think, okay, pancreatic cancer, or those could be indicative of numerous different things?
Sure. So other conditions like hepatitis or other problems with the liver can cause jaundice, but certainly one should be alarmed and should seek medical attention right away.
Sure. Okay, so you find out you have pancreatic cancer. At that point, what do you do in terms of treatment?
Well, hopefully the patients are early in the disease course, and then we can offer potentially curative surgery. Unfortunately, the majority of patients have more advanced disease, and then chemotherapy is the mainstay of treatment.
And where does pancreatic cancer rank in terms of the most common forms of cancer?
So while it's the 10th most common cause of cancer, it is the much more prevalent in terms of the risk of death from cancer.
And obviously with Emily Curritt being from the area and whatnot, at least that brings a little bit of notice and awareness for people in our region.
Absolutely. And we have a unique opportunity in that UVA established a high-risk pancreatic cancer clinic to screen patients who might be at increased risk. And we've been very successful and have to date, in the past 2 years, screened several hundred patients extending from New York to Florida and have had great success so far.
All right. Dr. Bauer, appreciate your